titled this Menopause, the Health of Women and HRT, which stands for Hormone Replacement Therapy, because we often hear the term women's health, which can often get misconstrued as, related to, pregnancy and things like that. So I'm using the term health of women, which I believe Lisa Mosconi coined recently. I would like to thank the leader of the movement, as well as the continental leader of the USA, for allowing me to present this and encouraging me as to how important this topic is to the members of the movement. Now, I'd also like to thank the person who personally invited me to speak about this in the first place. I will be referring to information from the book Estrogen Matters by Dr. Avram Blooming, MD, and Carol Tavris, PhD, when speaking about the most important information about HRT and menopause. The members of this movement have learned about the importance of understanding the issue of abortion and the truth about how it impacts women of childbearing years. I myself was on the fence for a long time about whether it was a good thing or a bad thing. It was the same with gender inequality. I couldn't take a stand one way or another without understanding those issues better. And I'm sure I can speak for everybody else as well. Now we have seen through the study of books and videos and news articles that we can use this information to take a stand by voting for those who stand on the right side of these issues. We can communicate this information to others and witness for the truth about it. This has made us more relevant to God and His purposes toward us. Our understanding of women's suffering is growing day by day. Our understanding of what happens to women in wartime is also growing. But there's one segment of the female population that hasn't received as much attention in the world or in the movement, and of course the church. This has much to do with a lack of information about the subject as the overall shame and resistance to talking about it in public. This has gotten a little better since certain celebrities have spoken up about it, and since Jill and Joe Biden have begun to have a greater interest in and proclaim a need for an increase in funding and research at the National Institute of Health, and have called for a task force to study and report on findings related to women's health issues. For the first time in a long time, since before 2002, that's a long time, they're also now calling for an increased understanding of older women's health and the need to equalize the importance of listening to us and working towards alleviating the complications of aging, especially in regard to menopause. This topic has been lightly touched upon in presentations others have done in the movement over time, connected to the subject of inequality in medical care between men and women. The book Unwell Women is one of the books that touch on women's health issues in the medical system. The Pain Gap is another book that mostly focuses on health issues of women of reproductive age and how they suffer. There are health issues suffered by peri- and postmenopausal women specifically, and I would like to discuss it more in depth because I have found that there is still a lack of understanding or knowledge about our experiences both in the world and in the movement. As we are expected to understand women's health issues related to current events and the politics of this time, then we must be inclusive of the largest demographic in the world today, menopausal women. All women will go through menopause, but not all women will get pregnant or get married or have children. As radical trans-inclusive feminists, we should also get to the root of the problem. That is the lack of information about the transition and why that has happened. In addition, I would like to clarify points where some feminists have not been as transparent or relevant in regard to the most up-to-date information about menopause and the treatments that are currently available. They're good when it comes to pointing out where the medical community went wrong in the past, as the author of Unwell Women pointed out in the chapter titled Feminine Radiance. But many seem unable to be relevant in relation to the latest medical advances for treating the debilitating symptoms many postmenopausal women face at this time. This can cause us to think we should just suck it up and avoid complaining and seeking help. We've taken feminists' word on a lot of things over the last few years, but I believe this is a case where we need to let doctors, especially menopause-trained experts who are following the latest findings, advise us on this topic. And Dr. Avram Blooming, MD, Carol Tabert's PhD in the book Estrogen Matters, highly quoted by pretty much all of the OBGYNs and others who are speaking about this right now. Thank you. This book is Menopause Bible. If I hadn't found this, I don't know where I'd be right now. So, let's see. So let feminists teach us about what they know best: patriarchy and sexism and misogyny. We also need to know what the latest findings are about the treatment of menopause and read the books and studies that are available to us at this time. It's not 2002, and we have to be relevant and useful to God's purpose for us now. I didn't have answers for women when they asked me in desperation years ago if I knew what they could do for the symptoms of menopause that they were suffering from. Even I didn't have an answer when a woman would ask me if it was God's will if she had an abortion years ago. All of that has changed. The average age of onset of menopause is 51 in the United States, although it can happen anywhere from 30s to late 50s. This is defined as the absence of periods for 12 months. And even that definition is coming into question now. Symptoms can occur prior to this time during perimenopause as well as after. What are those symptoms? I have a partial list here, although it'll seem long. Hot flashes, night sweats, difficulty sleeping, insomnia, difficulty concentrating, decreasing recent memory, decreasing energy reserve, bladder urinary discomfort, more frequent urinary tract infections, incontinence, genitourinary symptoms of menopause. This becomes worse with time and very painful. Vaginal discharge, vaginal bleeding, loss of sexual desire, painful sexual intercourse due to the lack of lubrication. This can feel like being cut with a razor blade or sandpaper, with the most effective therapy for this being hormone replacement therapy or estrogen replacement therapy. And the tissue can literally be de-aged through this process. And depression, sadness, tension, nervousness, mood swings, headaches, bloating, swelling of the hands and feet, breast tenderness, aching joints, thinning hair, palpitations, and racing heart. Oprah Winfrey had this symptom. Chest pain with exertion, weight gain around the abdomen. There are many more symptoms than this. I've heard lately possibly 70. I ticked a number of these on this list for myself. The Declaration of Sexual Rights is a statement on sexual rights that was first proclaimed at the 13th World Congress of Sexology, run by the World Association for Sexual Health, WAS, in Valencia in 1997. A revised version was approved in 1999 in Hong Kong by the WAS General Assembly and reaffirmed in 2008. It was revised and expanded in 2014. This declaration included the right to the highest attainable standard of health, including sexual health, with the possibility of pleasurable, satisfying, and safe sexual experiences, the right to enjoy the benefits of scientific progress in its application, the right to information, the right to education, and the right to comprehensive sexuality education, the right to sexual pleasure, and the right to sexual health care. I can tell you from experience that these rights are not being fulfilled for postmenopausal women in the United States, in large part due to women being dismissed by their doctors who are untrained as well as sexist in their approach to the treatment of the symptoms of menopause. Only 7% of doctors are capable or willing to help women with these symptoms for their lack of training. This is affecting women's marriages and has led to a very high divorce rate for those over 50 and the loss of employment among menopausal women. Perimenopause is when certain symptoms can start, and because they come on slowly over time and increase in severity as women's cycles become more erratic and heavier, and finally they stop menstruating, they can mistake the symptoms as another illness when they aren't educated about what is causing the symptoms and what to do about it. There's a lot of misinformation from books and media about the subject. And there are companies now that prey upon desperate women to buy products and services that either don't safely alleviate the symptoms or don't alleviate the symptoms at all. I myself didn't know what was happening to me when I was in perimenopause. My symptoms led me to believe I was very ill or even dying. I tried phytoestrogenic herbs for a time, but as I started menopause, they were very ineffective, as they are very weak in their effect, much weaker than our own estrogen our body produces. I was told that some herbs were estrogenic in their effects, and some were like progesterone in their effects. The information was not always correct, and I had no idea whether it was or it wasn't. I bought books on it in my 30s. And I thought if I read them, they would prepare me in some way when it was my turn. But they were from the, the naturopathic world, and yeah, they didn't prepare me at all. The fluctuation of estrogen and progesterone during perimenopause and the large decrease in progesterone, which is the pregnancy hormone, can cause an imbalance between estrogen and progesterone, and thus can allow estrogen to overstimulate cells in the uterus, which causes the beginnings of or worsening of fibroids and endometriosis due to the uterine lining getting too thick. Periods can be very heavy, prolonged, short, frequent, or very infrequent, and can cause a lot of quality of life issues, as some of you might imagine. This can cause accidental pregnancies as well, when a woman doesn't know if she's ovulating or when. If your periods are all over the place, you're not going to know when that's happening. So I learned too late that the right solution to that problem is to obtain a prescription from a knowledgeable and qualified doctor for progesterone to prevent heavy or irregular bleeding. This was happening to me around the time I saw many of you at the 2019 Arkansas camp meeting. I almost didn't go because my life was in complete chaos. Women are usually prescribed progesterone by a doctor to prevent these problems if they are in perimenopause and still menstruating. I was not aware of this remedy, and since I didn't believe in taking prescription medications, the naturopathic doctor I was seeing at the time told me to use a topical progesterone cream. Found out later that progesterone doesn't absorb well transdermally, and this treatment wasn't regulated by the FDA. I also tried wild yam cream per a Adventist naturopathic source, but later learned that this was an estrogenic herbal remedy, so I became anemic because of the prolonged and heavy bleeding. This can last a month or more or less, depending on the thickness of the uterine lining at the time. So getting the right information is very important as you're going through this process, and finding a doctor that actually knows something about it, like a menopause expert, is essential. Why aren't more women aware of what to do about these symptoms and the cause before they happen? We're taught about puberty and reproduction as early as age 11. Why are we not taught about what happens at the end of the fertile stage of our lives? The answer to that, I believe, is twofold. One reason has to do with sexism and ageism. Our whole culture is obsessed with youth and how to avoid old age. The media promotes youth, and one can hardly see older women in movies unless they're playing a role that demeans them. If women are empowered to understand what the cause of those symptoms are and how to best offset those symptoms before they begin and before they become chronic and they later develop into diseases that will kill us, they will be able to make the right decisions. For example, heart disease is the #1 killer of postmenopausal women. That's right, not breast cancer, but heart disease. You may wonder why so many of us are dying from a disease that's preventable, but apparently not so easy to treat once we have it. For that answer, we must look at the history of the most effective and popular treatment for menopausal symptoms in the 1990s, hormone replacement therapy. It was even promoted in a popular movie of the time called Fried Green Tomatoes. And that summed up my whole education about it at that time, what I saw in the movie. The history of hormone therapy starts as early as 350 BC, when Aristotle first observed that women would stop having periods sometime between the ages of 40 and 50. Lifespans were pretty short back then, so not many women got to completely experience it and live to talk about it. This was also true 100 or so years ago. Today, because women can live 80 years or more, we're living an average of 30% of our lives in menopause, and it does not end until we die. As we are now also aware, in ancient Greece and other ancient civilizations, a woman's value was linked to her ability to bear children. Those who could no longer do so were not worthy of much interest or study. The Bible mentions 2 women, Sarah and Elizabeth, who were menopausal, but who were given the ability to conceive anyway. Not very many. Menopause remained basically invisible until the 19th century. Around the time male physicians discovered women's brains, they also discovered menopause. The word menopause didn't exist even until 1821, when French physician Charles Jardin borrowed from the Greek word men, which means month, let's see, and Pauein, 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 which meant pause. Although this has nothing to do with men in that regard. Defining the time when a woman's period stops. Physicians of the time began to blame menopause symptoms on the uterus, from the Greek word, hystera, hysteria. So from which the word hysteria comes from. They thought that if the womb was diseased, it should be removed. Along with the uterus, they tended to remove the ovaries, which then plunged women overnight into menopause, making a woman's symptoms even worse. After the surgery exacerbated the issues, the asylum became the obvious solution. Women were diagnosed as being crazy or demented and locked up in mental institutions, even had to submit to electric shock therapy. The misguided treatments they were given by their doctors were likely the reason they suffered these abuses. The video of Sinead O'Connor after she had had her hysterectomy, comes to mind. She was not given hormone replacement therapy soon afterwards, and the results were not surprising. She had to ask for the medication at some point in order to get relief from her symptoms, but not all women are given it anyways. Sometimes it's withheld. During the 20th century, women gained extra years in suffrage and cultural power, and in return, menopause came to be seen as worthy of medical attention instead of institutionalization. Along with the hormones insulin and thyroxine, in 1934, the hormone estrogen is discovered. The word is derived from the Greek word oistros, which means frenzy or mad desire. And this supported the idea that female physiology was connected to mental instability. Joy, joy. Once it was discovered that menopause was caused by a decrease in estrogen production by the ovaries, pharmaceutical companies jumped at the opportunity to provide hormone replacement therapy as a treatment of choice for the symptoms of menopause. This treatment got a bad rap, though, in 1966 when Robert A. Wilson, MD, author of Feminine Forever, promoted the idea that menopausal women were crippled castrates. That HRT would make them something they couldn't be otherwise. David Rubin's book, Everything You Always Wanted to Know About Sex, but Were Afraid to Ask, came out in 1969, also had choice derogatory things to say about menopausal women. For example, once the ovaries stop, the very essence of being a woman stops. And a postmenopausal woman comes as close as she can to being a man. Not really a man, but no longer a functional woman. The type of synthetic progestin used at the time, medroxyprogesterone acetate, or MPA, was also linked to more unpleasant side effects and an increase in breast cancer risk, although very slight. Premarin was derived from pregnant mare urine, which was the conjugated estrogen used, and it was used in much higher doses in that time period than we get prescriptions for today. By contrast, we have more options today, such as micronized natural progesterone, and like today, commonly prescribed estradiol, both of which are atomized molecular replicas of the progesterone and the estrogen we make in our own bodies, and are much less likely to cause breast cancer and other unpleasant side effects when taken at the right time or at the onset of menopause. So to sum it up, the form in which it's taken can be important, and the timing of use when it comes to tailoring the treatment for each woman's needs. In the 1990s, scientists began to understand that our sex hormones were the key not just for reproduction, but also for brain function, heart health, and bone strength. My own blood pressure increased as soon as the onset of my own menopause and the hot flashes, but it decreased back to a very good or normal reading after I started hormone therapy. The memory problems I developed 2 years into menopause caused me to think I would have to quit my job because it took 2 years, for me to find somebody to prescribe it. My memory has been much more reliable since starting HRT. I don't have osteoporosis as of yet, but I've come to understand from the latest research findings that if I use hormone therapy for at least 10 years, I'll have much more resilient bones over the long term and less risk of fracture. Estrogen cannot cure any disease once it starts. It's purely preventative, thus the need to use it before the disease occurs in the first place. This leads to a discussion of the timing hypothesis. The risks and benefits of hormone therapy vary based on a woman's age, the length of time she's been in menopause. The effects of estrogen depend on when a woman starts taking it. As mentioned earlier, the average age of the onset of menopause is 51. I was 57. So prior to 2002, hormone replacement therapy was the most prescribed and popular pharmaceutical medication, and most women started hormone therapy at the time of menopause onset in response to symptoms like hot flashes. This is because hormone therapy is most effective when our bodies are still receptive to estrogen. It was discovered that if a woman waited 10 or more years past the onset of menopause, her estrogen receptors would not be as sensitive to estrogen. and thus the use of the therapy may actually worsen any health problems she may have at that time. This was a finding that originated with a study done in the 90s, but abruptly stopped in 2002. It is known as the Women's Health Initiative Study of 2002. It set the standard for pretty much everything menopause for the next 22 years. In July 2002, the NIH issued a press release that the WHI was stopped early due to an increased risk of invasive breast cancer among the participants. The JAMA issued a press release and paper called Hormone Therapy Stopped Due to an Increase in Breast Cancer Risk. It also indicated that there was an increased risk of coronary heart disease, stroke, and pulmonary embolisms. More headlines followed in the media, including the New York Times. The WHI is known as the largest prospective study in which women were randomized to take hormones or placebo and studied over time. The randomized controlled trial is considered the gold standard of scientific research, and it cost $1 billion. They did not want to repeat it. This led to millions of women throwing out their hormone pills because of the fear of breast cancer and a lack of training of doctors about menopause care for the next 20 or so years. It's been referred to as the flush heard around the world. One of the findings of the study was that for those who took both estrogen and progestin, there was a 26% increase in the risk of breast cancer compared to placebo. That is a change of 5 in 100 women to 6 in 100 women. This almost reached statistical significance, according to those who carried out the study, but it fell short and could have been the result of a spurious association. The results of the study are not considered statistically significant unless the probability that its results are due to chance alone is less than 1 in 20. The media and the doctors treated that 26% increase risk as being both statistically and medically significant. There is actually a better prognosis for women who have already been taking hormones and who later get cancer, according to that same study. By 2006, the WHI reported no increased risk of breast cancer using estrogen and progestin. The supposed risk had disappeared. In 2010, 2.6 versus 1.3 deaths from breast cancer occurred per 10,000 women. Again, not statistically significant. Over time, the number of women with breast cancer increased from 1 in 13 prior to the study to 1 in 7 today. Apparently, less women taking hormone replacement therapy doesn't protect against this disease. It was stated that healthy women were recruited for the WHI, but this was not true either. 35% were considerably overweight, 34% were obese, 36% had high blood pressure, and 50% were current or former smokers. They were on average 63 years old, long past the onset of menopause, and past the time when they would have had symptoms. The findings, however, were generalized to the entire population of menopausal women. Little mistake. In 2014, Samuel Shapiro at the University of Cape Town Medical School said major damage had been done to the health and well-being of menopausal women because of the misinterpretation and overinterpretation of the findings of the WHI study. Those most capable of correcting the critical misinterpretations of the data were actively excluded from the writing and dissemination activities. The JAMA issue was published before editing could be done. Key scientific conventions had been violated, such as statistical accuracy, co-author review, and publication in a professional journal before press releases. It did a whole generation, and more to come, a huge disservice. Oh, we heard this morning 50,000 women died as a result of flushing their pills down the toilet. The principal investigator of the WHI, Jacques Rousseau, was a cardiologist who said that the WHI was intentionally going for high impact when it called a press conference because they didn't want their news to get lost in the shuffle of daily news events, and especially when their goal was to shake up the medical establishment and change the thinking about hormones. There was an agenda from the beginning to change the public's thinking about hormones and prove that they were unsafe. Rousseau had claimed to lament the widespread use of estrogen and wanted everybody to get off the HRT bandwagon. One has to ask, what does a cardiologist have to do with women's gynecological health? You have to wonder. The media also tend to report relative risks like researchers do, expressed in percentages, which makes things sound worse than they are. I previously learned of this phenomenon in the book Fast Brain, Slow Brain. Knowing the baseline absolute number of new breast cancer patients in women who take HRT is also important. Misinterpretation of findings also happens when data mining occurs. This is when researchers who have failed to find a statistically significant association that they thought would exist between a possible risk factor and a disease, they go looking around in the data for other factors that might show a statistical link. They would rather be right and are willing to bend their experiment's findings to fit their theories. If you torture the data long enough, the numbers will prove anything you want. So how can the very hormones that allegedly increase the risk of breast cancer also be responsible for better survival from that cancer? Women who take HRT live longer and have a lower death rate from all-cause mortality, including breast cancer. So why was there more concern about women getting breast cancer over the last 20 years as opposed to heart disease, osteoporosis, and dementia, which affect and kill far more postmenopausal women these days than breast cancer? Lisa Mosconi, an associate professor of neuroscience in neurology and radiology and director of the Alzheimer's Prevention Program at Weill Cornell Medicine, New York Presbyterian Hospital, wrote in her book, The Menopause Brain, that the term bikini medicine explains this major healthcare challenge of our time. This is a practice of reducing women's health to those body parts found beneath a bikini's confines. So in other words, what makes a woman is our reproductive organs and nothing else. Least of all our brains. But she's, shedding light on all that right now. Through the 80s and 90s, through the 80s and 90s, studies had showed that estrogen doesn't cause or make breast cancer worse. And it has a preventative effect against heart disease, osteoporosis, and dementia. The fear-mongering done by the media and doctors after the WHI findings were published by the media scared women into thinking hormone therapy caused those diseases, and thus they abruptly stopped using the therapy, which necessitated creating and using bisphosphonates for osteoporosis, statins for heart disease, and drugs for dementia. In women, that turned out to be disappointing alternatives. The side effects were worse than that of hormone therapy, and the dementia drugs didn't cross the blood-brain barrier. Statins, like many medications, were developed and tested on men with men in mind. Women's hormonal cycles were used as an excuse to avoid testing drugs like statins on women. Thus, they tend to be less effective as a treatment for heart disease in women than hormone therapy. This originated with the thalidomide crisis in the 60s. Bisphosphonates can only be used for 5 years per the latest recommendations, and their effectiveness is less over time. And they can cause necrosis of the jaw and broken femurs if they're used for too long. Once you have osteoporosis, you may have no choice but to take bisphosphonates, as estradiol cannot cure it. There are side effects to all of those alternative medications that HRT doesn't cause. Another finding is that while exercise can help improve bone strength and resistance to fracture among premenopausal women, this doesn't occur amongst postmenopausal women who are not using hormone therapy. Bone density can be measured with a DEXA scan, DXA. We'll write that on the board. It's something they tell all older women to get, amongst lots of other things. But it is an inaccurate measure of fracture risk. It is even more important to address our bone's response to tensile stress and its resilience, which cannot easily be measured. One would have to take a bone, put it in a vise, and discover how much stress it would take to break or bend it, which is not practical. BMD tests are supported by it's called bone mineral density tests, supported by the pharmaceutical industry to test for osteoporosis. I've had one done in the last year, but it actually was not intended to be the sole clinical criterion for determining drug treatment. Later, the term osteopenia was invented, which according to the World Health Organization actually has no clinical significance, does not even predict the risk for osteoporotic fracture. Does anyone know what is a strong predictor of fractures? And I'm posing this question to everybody, if anybody knows.
Well, I read at some point that like a one-legged squat, or there's certain exercises or movements that if a person can do it, it's supposed to be an indicator that they're less likely to get fractures.
Well, the answer given in this book, I'm not discounting these exercises. I do them myself. I've been doing them. And I don't discount them for premenopausal women. But the actual strongest predictor for fractures is a history of falls, which I also have. My fall in 2020 changed the course of my life. In 2021, and every older woman I know who falls, it's severely consequential. And prior to that, I would just get up and go on and nothing would happen. And, life would go on. But something happens after menopause. It's losing your bone strength. I mean, losing your muscles, your muscles is one thing. And these things are progressive over time. But yeah, a history of falls is one of the strongest predictors. While bone mineral density tests are prescribed on a routine basis now for women 65 and older, the intervention of pharmaceutical drugs has produced results that are inconclusive at best. If we think of a bone as being similar to a tall building, and the girders would be similar to collagen fibers that provide structural support, elasticity, or tensile strength, or the ability to bend in response to stress. This internal framework is called the osteoid. Upon this framework, calcium is deposited, and this creates the outer shell of the bone, like the external face of a building. This calcium does not increase the ability of the bone to bend without breaking. It will add to the stiffness and supportive strength of the bone, but its flexibility will be decreased. When women age, the collagen becomes more brittle and thinner. This will weaken the bone and increase its potential to break. Osteoporosis and bone fracture, which can cause disability and even death, will become more common as women are increasingly living into their 70s, 80s, and 90s. The most effective intervention with the least side effects for preventing osteoporosis is currently hormone replacement therapy or estrogen replacement therapy. The hormone replacement therapy is prescribed for women with a uterus, the estrogen alone for women without. It's because the progesterone protects the uterus from the effects of the estrogen, causing up a building of the uterine lining and possibly uterine cancer. These medications can reduce hip fracture by 30 to 50% if used prior to the onset of osteoporosis and early after the onset of menopause, or even before. Calcium and exercise are effective in improving bone strength or resistance to fracture in premenopausal women, but as stated earlier, they alone are not effective in preventing the problem in postmenopausal women who are not using HRT and ERT. This is because only estrogen can prevent the loss of resilience and tensile strength in the bones. For women who are at high risk for osteoporosis, this is a game changer. Estrogen plays an important role in regulating bone health by inhibiting the osteoclast cells that break down bone. It reduces bone resorption by its effects on the parathyroid hormone and calcitonin. Calcium is needed to build bone, and estrogen speeds up the absorption of calcium in the intestine and reduces calcium excretion. Improving the quality of life for postmenopausal women by alleviating the symptoms that disrupt sleep is good enough reason to use HRT. Another reason is that the number of women who die annually from heart disease, 298,840 in 2018, is more than 7 times the number projected to die of breast cancer. This begins to become an issue after the age of 40. Between ages 60 and 79, it kills 4 times as many women as breast cancer does. Between ages 20 and 60, it kills 2 times as many women as breast cancer. Only 8% of women recognize that heart disease and stroke are their leading cause of death. One explanation is attributed to the availability heuristic, which is a tendency to judge the probability of an event by how easy it is to think of in instances of it, and how emotionally compelling those instances are. Terrible events evoke a strong emotional reaction, so they're easily remembered and are more mentally available than other negative events. Women will overestimate the deaths from breast cancer and underestimate the number of women who die from heart disease because the information they receive about breast cancer is so much more available to them through the media and medical resources, and so they tend to hear about it more than heart disease. This was my own experience going to doctors. All they cared about was what happens with breast cancer. They didn't care about my heart or anything else. This is also because the symptoms of heart attacks are less understood in women and tend to be more fatal to us, as we are often misdiagnosed or dismissed about our complaints and symptoms at the doctor's office. We're often told we have anxiety when in reality it could be something worse that's afflicting us. Menopause itself is dismissed as the symptoms it causes, which are many. We're often prescribed medications to treat individual symptoms of menopause when the root cause is low estrogen levels. As radical feminists, we have to primarily be interested in the root causes of problems, as another member recently pointed out in one of her last studies. In the end run, even women who have had breast cancer are more likely to die of heart disease than breast cancer, whereas 90% of the women diagnosed with breast cancer are cured after their initial treatment. Using estrogen replacement therapy, however, alone, led to a 40 to 50% reduction in the risks of coronary artery disease. Because of our present longevity, women live to 80 years or more now, which was rarely witnessed in previous centuries. With the average age of menopause being 51, we live 1/3 to 1/2 of our lives after the onset of menopause. We now know that estrogen stimulates the growth of nerve cells, regenerates axons, and decreases the nerve cell death that happens in Alzheimer's. It also makes brain cells more responsive to the effects of nerve growth factor and reduces the production of substances associated with Alzheimer's like beta amyloid and tau protein. Estrogen can also reduce the levels of vasoconstrictors, which narrow the arteries, and increase the levels of vasodilators, which expand or widen them. It can increase blood flow in the brain and inhibit substances that cause inflammation in the early stages of atherosclerosis. It enables neurons to survive brain injury and disease. In younger women just entering menopause who were in good health, estrogen does not increase the risk of dementia or cognitive impairment. But in women who had pre-existing cognitive impairment and who started hormones long past the onset of menopause, over age 75, there was a slight increased risk of these conditions. This was especially true in women who were overweight, hypertensive, or smokers, or all of the above. The healthy cell bias hypothesis holds that estrogen confers cognitive benefits when the neural substrate is healthy but not diseased, as in a woman with diabetes mellitus. The way this information is gathered and interpreted is the story of two different types of studies and the controversy surrounding them. The RCT, or randomized controlled trial, is considered the gold standard of conducting medical research. In this type of study, a group is randomly assigned to either receive treatment or a placebo. And if it's double-blind, neither the participants or the investigators know who is receiving what. These studies are typically very expensive. They take a long time to conduct, and they include a less broad range of patients. And they tend to be unethical or impossible in situations where an observational study would be appropriate. In an observational study, the participants are simply observed to see if a treatment's working or not. There have been many of those. Although there's also a chance that women who choose to have the treatment may already be healthier, wealthier, and more educated than those who don't choose to have the treatment, and that those characteristics may be the reason for a better outcome. And that same group of women might be more likely to be able to afford to, participate, take time off of work, participate in studies. Black population, the Latino population is largely left out of these things for those reasons and others. Randomized controlled trials are not perfect, though. Biases and statistical distortions certainly do happen with them, like in the case with the Women's Health Initiative study in 2002. When a randomized controlled trial is carefully conducted, it has been found to produce results that are similar to observational studies. Even the man who developed and promoted the randomized controlled trial, Sir Austin Bradford Hill, at some point believed people had taken it too far. He also said that if such trials ever became the only method of assessing treatments, not only would the pendulum have swung too far, it would have come off its hook, which I believe it has in this case. And I kind of thought through all this and pulling together what we've learned about abortion and everything within that realm, and what I've learned about this subject, I began to see a lot of similarities. And this is a comparison of the effect of restricting healthcare in both those needing an abortion and those needing hormone replacement therapy. What have we learned in the movement about abortion in the last few years? I'll bet we know a lot more than we did a few years ago, thanks to the education we've received from the sources that we look at. Number one, women now do not have universal access to abortion services, even when their own life is at risk. Number two, women are now denied medication, which enables them to have an alternative form of abortion. They are denied the choice. Number three, women denied access to abortion when needed to save their lives often live with long-term complications and or lack the ability to have children in the future. Number four, women have had to start traveling long distances to access abortion, or they must use telemedicine because it is illegal to get an abortion in their state. This can be costly, and if not available within the proper time frame, because of a lack of access, it becomes more difficult as the pregnancy progresses to access the procedure. Number 5, women are being turned down for an abortion by doctors who are afraid of prosecution or lawsuits because of politically motivated laws in the states that they live in. This gives women fewer options to obtain medical care. Number 6, the fact that abortion is a safe procedure was not understood by the movement at one time because we conservative-minded people believed misinformation, disinformation, and even conspiracy theories about abortion. Number 7, women suffer economic impacts when they're not allowed to access abortion. Women lose the ability to get an education, job skills, and upward mobility in their jobs. What do we know about accessing care during menopause? A lot less, I would imagine. Number 1, women do not have universal access to treatment for their symptoms in menopause, even when they're suffering and losing their ability to care for themselves, their families, and to do their jobs. Number 2, women are denied the one medication that can truly alleviate their symptoms while causing the least side effects to themselves, compared to other medication choices. They are denied choice. Again, number 3, women are denied access to hormone replacement therapy when needed to preserve their quality of life, marriages, and jobs, and often live with long-term complications, dementia, heart disease, and osteoporosis, and will lack the ability to access the medication in the future after developing these diseases. The doctors who won't give it to healthy women are sure not likely to give it to women who already have these diseases. It can be unsafe to use HRT once those diseases exist. The side effects of the alternative medications are worse and sometimes require the use of additional medications, surgeries, and hospitalization. Number 4, women have had to travel long distance to access hormone replacement therapy, or they must use telemedicine, as I had to for a year, because it is difficult, if not impossible, to access it where they live. I found one doctor in the whole Chicago area. This can be costly, and if not available within the proper time frame because of a lack of access, it becomes more difficult as women age to access the treatment. It took me 3 years to find a local physician willing to prescribe HRT. I was 2 years into menopause when I used telemedicine. I'm in the process of transitioning. Number 5, women are being turned down for treatment in menopause with hormone replacement therapy by doctors in the state they live in who are afraid of lawsuits because of the universal application of the detrimental findings of the WHI, which were applied to all women instead of the demographic that was actually affected in the study, which was women over 62 or 63 and 10 or more years postmenopausal with comorbidities. The medications used at the time of the study are also different from the ones used today. This gives women fewer options to obtain medical care. And the Premarin they used in that old study, today, it is the most tested, the most studied form of estradiol, which is Premarin. It actually contains 10 different types. It even contains testosterone. Number 6, the fact that hormone replacement therapy is safe and does not cause cancer, heart disease, or dementia in healthy, younger postmenopausal women without comorbidities is not widely known or believed today because people are still holding on to misinformation and disinformation and even conspiracy theories and not being told the truth by their doctors due to the lack of training they receive about menopause, and not knowing that the original findings promoted in the media have since been walked back and properly interpreted for the symptomatic population most affected by menopause, women under 60. I had to send the latest copies of the most recent statements from the NIH and the NAMS, Menopause Society, to my doctor and take them to my appointments as proof that things had changed regarding HRT. I also brought the book Estrogen Matters with me. I now soon will have a stack of them. It didn't matter one way or another. It didn't change any doctor's mind. It wasn't until I, got on the right path of finding doctors who were trained to, handle these situations that, I was able to access treatment. Number 7, women suffer economic impacts when they're not allowed to access HRT or estrogen replacement therapy. Women lose the ability to keep their jobs and perform their jobs to the best of their ability. There are articles in this subject which I've posted previously in the Bible study chat. When these women start HRT and begin to feel better, they can often launch themselves into wholly new directions job-wise. As one woman I read about retooled herself into becoming a menopause awareness activist after losing her old job. And most of us do lose our jobs. For one reason or another, we physically can't handle it anymore, or mentally, and then we have to go in a totally different direction. I like this quote from the New York Times article. The future isn't female anymore. In her forthcoming book, Bad Sex, Truth, Pleasure, and an Unfinished Revolution, Nona Willis Aronowitz writes that her mother, the second wave writer Ellen Willis, met with the same women's group for 15 years. Such groups can keep people tied to a movement and to one another through disagreements and lulls in political action. Without them, activism becomes more evanescent. People gather during emergencies and then disperse. There are menopause cafe meetings in the UK, which can provide support and interaction on the subject in the communities in which they occur. Nothing like that happens in the United States, to my knowledge. When feminism is most alive, it's another quote, it helps women articulate things they've been unable to say and makes them feel less alone. Also very important through this phase, change of life. Think of consciousness raising meetings in the 70s and zines in the 90s. A zine is a magazine about a particular subject written by people who are interested in that subject rather than by professional journalists. Or Me Too, just a few years ago. As feminism grows more powerful, though, it creates its own taboos. When feminism itself becomes an impediment to women talking about the truth of their lives, it goes into decline. We must not allow this to happen in the movement. The reason I bring this up is that many feminist writers, even those we have read to educate ourselves on feminist topics, also hold on to outdated information in regard to menopause hormone therapy, instead of embracing the latest research and correct interpretation of older studies that have not been used properly. And encouraging women to ask a menopause specialist to consider whether they're a candidate for hormone replacement therapy and whether it can alleviate their suffering. I'm a witness that it can. Feminists still parrot the old misunderstandings that they themselves refuse to look at more closely because those findings and misunderstandings fit their worldview when it comes down to whether a woman should access the treatment to alleviate their symptoms. They portrayed those women as using the medication to please men or to be like men, and they seemed indifferent to the fact that everyone should be given the choice as to how they manage their menopause. They talk a lot about the bad things that happened in the early days of the development and use of hormone therapy, endocrinology, gynecology, but refuse to consider the improvements that have taken place over time to this present day. And if there had been proper funding for the last 22 years at the NIH, who knows where we'd be today. Carol Tavris, PhD, who co-wrote the book Estrogen Matters, I quote as saying that because she was a feminist psychologist, she was very critical of the assumption that once a woman hits menopause, she needs to fill her tank with estrogen. After reviewing the facts of this matter with the author, Dr. Avram Blooming, MD, oncologist with 40 years experience, I'll add, she has since changed her mind, which is how she was able to support the idea of the use of HRT to alleviate the symptoms of menopause. She herself was one of those women who sailed through menopause without experiencing the symptoms many women suffer from. And yeah, it happens. HRT doesn't make us 20 again, but it can prevent chronic illnesses from developing by doing what it has always done in our bodies from the time we came into existence. And I'm referring to before we're born, from 5 months of age onward. That is, it regulated our body temperature, helped us sleep through the night, prevented brain fog, bladder infections, low energy, painful sex, loss of libido, depression, anxiety, moodiness, headaches, bloating, aching joints, thinning hair, palpitations, and weight gain around the abdomen. By understanding all the facts about menopause, we can be more understanding of those experiencing it and be able to help others make the right decisions about how to find the right information for themselves, and thus empower and advocate for other suffering women to find a way to overcome their suffering and live their lives to the fullest. This will require more doctors to receive the training and education about caring for menopausal women, with 93% of them not having received these, training and education since the findings of the WHI were initially published. And I'm also referring to doctors outside of obstetrics and gynecology, because estrogen affects every organ system of the body, from the heart to the brain, bones, muscles, you name it. This is a worldwide problem, but countries like the UK have been making progress in addressing this issue, while the US is just beginning to allocate the funds and is now requiring the NIH to do the work of evaluating women early in their menopause journey to prevent the problems that can occur when hot flashes and other initial symptoms are ignored and dismissed. Women have made great strides across time in overcoming the trappings of patriarchy, and this involves suffering, as we now know. But some suffering, however, is very unnecessary. As an addendum to this, just recently in the last month, the Lancet, another big important journal in the medical world, is coming out against the progress that's been made and trying to turn us back to 2002. And the internet personalities, doctors who are leading this movement are definitely in an uproar about it, and they're raising an uproar online. We can only hope that things don't start to go backwards again and that progress can continue. I wanted to share the names of some other books that I, come to look at recently. One is called The Menopause Manifesto by Dr. Jen Gunter. I have looked through what I could access online, and it seems really good from the perspective of getting to the nitty-gritty of what's going on biologically, which, I don't know enough about, and probably anybody without an MD doesn't know enough about, because we all don't know much of anything about this. And then there's The New Menopause by Dr. Mary Claire Haver, one of the biggest, influences online right now, just come out with a new book, which I ordered. And there's another doctor, Dr. Lauren Stryker, who practiced in Chicago, downtown at Northwestern until recently, whom I would have met had I gone 2-3 years ago to see her when I needed to. She has also written several books that I had a chance to look at while I was at Northwestern downtown. One was called Hot Flash Hell. Another was Slip Sliding Away. Both look like really good books. And then there's The Definitive Guide to Perimenopause and Menopause by Dr. Louise Newson in the UK. I also listened to her a lot, and yeah, between all of them, the information is just building every day, and it's sure to increase with time because it is exploding right now. What time is it? Okay. So I'll leave a little time here if there's any questions, comments about any of this information. we have some time now to talk about it.
Linda, thank you for the informative presentation. I really appreciate it. So just correlating with breast cancer, HRT and breast cancer. So it's a lie that the male doctors published just to discourage women from using HRT?
Well, they've never used the word lie, but like I tried to emphasize, the WHI did good things. I mean, it was huge, it was expensive. And what they did wrong was they took the findings from the women 62, 63, 65 and up, and even older, who had comorbidities, and they just put them on these medications 10, maybe 15 years after they started menopause. And like I pointed out in another part of the article, another part of my presentation, your estrogen receptors, which are all over your body, after a while, after your estrogen is like 1%, it drops from like 300 to 1. When that happens for a long period of time, the receptors can start to shut down. And while that's happening, these diseases start happening because your vascular system is affected. You get more arteriosclerosis, atherosclerosis, your blood pressure will go up. I experienced this. And I thought, well, I've been a vegan for 36 years. Nothing's going to happen to me. I used to say that. And then I just crashed and burned into this about 2-3 years ago. So it's very unpredictable when it's going to happen and how it's going to happen. The 26% increase of breast cancer was 0.5% of total test population. Here's my math expert here. I didn't totally understand all the statistical stuff, but the absolute numbers are what you really want to look at. The percentages are used to create an uproar, which is what they were definitely aiming for. And I mentioned early on too that it was a cardiologist that was trying to derail the progress that was being made. And so ask yourself the question, why is a cardiologist getting involved in all of this? He's not a gynecologist, not a primary care physician, he's not a menopause expert. And I pointed out how the women who were on HRT for a period of time were more likely to have better prognosis when it came to breast cancer if they got it. There's no real indication it was causing the breast cancer. Cancer can take 7 years, according to another doctor I listened to, 7 years to go from one cell to a tumor. Now, if you've been on HRT for a little while, it doesn't absolutely mean, that it caused breast cancer. The factors that are most important for causing breast cancer are drinking alcohol. That's a big one. Processed foods, lack of exercise, obesity. Those are the things that tend to correlate more with getting breast cancer. And it can happen to people, it's genetics. But what he points out in his book is that even the women, who have those tendencies are having better prognoses. They're surviving these things better. And if we're with the health message and we're doing everything we're supposed to do, then that would put us in a really good category for, benefiting from these things if we happen to, fall into the, category of women who begin to suffer tremendously from this. Troy, menopause and hot flashes succinctly ties into patriarchy. These were insignificant to MDs. Oh yeah. It was men all along who were running all this, although woman was involved in this Women's Health Initiative study. Can't remember her name. She's also becoming involved in this latest controversy with the Lancet. Some of these people never gave up this idea of shutting all this down. And like we heard this morning, was it 50,000 women ended up dying after they threw their pills out, flushed them down the toilet. Well, if you just get off any medication abruptly, you're going to have issues. It was such a huge scare tactic. And what ended up happening, like I pointed out as well, they had to come up with new drugs to substitute for what the hormone replacement therapy was treating or preventing or whatever, mostly preventing if you started it early enough. Chronic pain, major, major, major problem, losing muscle. Yeah, I don't know if I answered your question, but to call it a lie, deception, but what were the reasons for it?
Hey,
We
Linda,
can only, yes.
one of the takeaways that I have from what you've shared and from what I've studied on my own is the World Health Initiative was this ginormous study, okay? And most of the medical profession, regardless of their specialty, they looked at the results or the takeaway that came out of the World Health Initiative regarding hormone replacement therapy, and the study was flawed. As you said, they used the wrong group of people with all kinds of comorbidities and other problems, and then they even went to further wrong conclusions with the study. And unfortunately, most of the rest of the medical profession, well-meaningly, is still holding that study, even though it's been 20 years in the rearview mirror or longer. They're still holding that as the gold standard. And so that's why most of the medical profession is still completely ignorant about
They're
hormone
not
replacement.
trained. They're not trained and educated about any of it. The doctors who are talking about it are saying, talking about what little education they got. And so you can't go to them and expect, any help on any of this. They're going to tell you, I'll give you an antidepressant. That happened to me. I'm like, I'm not depressed. I just need some, if you had low thyroid, they give you thyroid medication. If you had diabetes, they give you insulin. This is a hormone too. This is tied to that history of when those hormones were developed or, discovered. And the whole industry of endocrinology, or the, endocrinology began, and the study of the sex hormones was part of that. And as the feminists point out, there were huge mistakes made. There was abuse. There was horrible things that happened along the way. And the abuse that's happened over the last 22 years, I can't say it's been any better. Just withholding information, number one, and treatment, number two. There are so few doctors that are willing, like you said, they're holding on to these misconceptions. Breast cancer, bikini medicine, once again, breast cancer, if you have anything like I had, a typical ductal hyperplasia, lumpectomy, the lumpectomy alone can cause you to be more likely to get breast cancer if you're not taking hormone replacement therapy. There's side effects to this stuff, like there's side effects to everything else. And if problems do happen, from what I've learned, they tend to happen in the first year. And then after that, not as much. And I've gone through side effects with these things. But going back to the way things were, I mean, I looked like I was a walking zombie in 2002. After 2 years of not sleeping and chronic pain and whatever. And my experience is so similar to so many others. I spend some time reading comments online, and the anger is palpable. The boomers are pissed. It's the way it's been put. My age group is the one that's, kind of more involved in it, seemingly anyway. We're trying to resurrect this and, make things move forward while we still can. But yeah, it's.
Another question I had, in your studies, have you come across studies about stress hormones? Can it mimic or can it inhibit the formation of estrogen or inhibit the estrogen receptors, stress
It can
hormones?
compete. It competes. And I experienced this in perimenopause because I was stressed out. I mean, these things can stress you out. Like I said, it can increase the rate of divorce, your job losses. Yeah, and your stress levels are going to go crazy because, well, if you don't know what's going on and you don't understand, you think you're dying. And you're like, who do I go to see about this? You might get proper treatment, you might not. I mean, if you're in perimenopause, you might need progesterone because that's the progesterone from like typically age 40 onwards, it starts going down more than estrogen. They're all going down. Testosterone stays kind of level, spikes at ovulation like they all do, but over time, the progesterone's going down, 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 down. And then the estrogens, they like to use the word dominating. But when that's happening, then you're more likely to get fibroids, endometriosis, and you do not want them. I ended up with 2 of them, and it may be causing me problems now, even if they're small. Yeah. Yeah, the cortisol, to answer your question, it can compete with the progesterone, which makes it even worse. So you've got this spiraling out of control situation. And women are many times going through these things all by themselves. Nobody wants to talk about any of this. And people don't know. And you go to your friend and, sometimes your friend knows something and yada, yada. But if we're not all individually educating ourselves about this, especially, and I would say younger women, if you got daughters, yeah, bring them on board. They might, it can happen anywhere from in the 30s to the late 50s. You don't know when it's going to happen. If your mother had an early menopause, you're more likely to have early menopause. If she had a late menopause, you're more likely to have a late menopause. Most of my cousins have gone through it late, like me. And my sister did too. So there's a genetic factor involved. But just knowing, just being educated, just being validated by all these things it takes your stress levels down. It's that building that community, like I said, in that Future Isn't Female Anymore article, the groups, the sharing of information, we have to get on board about this. Like I said, I knew 2 women in the past, one at work, one at church. One at the church I went to over in Aurora here. Walk up to me. Do you know anything that will help get rid of these hot flashes? I was clueless. I told him wild yam. Well, that's not going to do a lot for someone, or a lot of women, I should say. Yeah, just knowing these things, it's like how we can counsel someone who's wondering if God thinks abortion is sin. Same thing. I mean, I didn't know what to, you do the best you can, but the more we know, the more we can help people. Got to break down the fear, the shame that surrounds this. And most of it's based on just we're ignorant about all of this. They don't hand out pamphlets at the doctor's office about this like they do about, what happens to your kids when they're growing up. Or pregnancy, that's what everybody wants to talk about. But we are the largest demographic in the world, and that's increasing by the day. Yes?
Another question is, so the woman's body, even though they're in menopause, never stops making estrogen, but it decreases significantly. Is that what you're saying? And also progesterone?
It's primarily your ovaries, like, oh gosh, what is her name? Oh, Mary Claire Haber. She's pointed out, she's the only one that's pointed out several times, that from the time you're 5 months gestation, you've got all your eggs you're ever going to have from that point forward. You begin losing them in large numbers, even by the time you're born. And by the time you're a teenager in your 20s, and by the time you're 30, you've lost a significant number of these eggs. These eggs become, as they're going through the reproductive process, they're able to produce estrogen, corpus luteum, I believe, producing progesterone. But anyway, the estrogen's produced based on these eggs, and as you go through ovulation and everything every month. And when those numbers get low enough by the time you're 40, for me, that meant something. I had gallbladder problems. I was, I'm more tired. I noticed these things early on. Like I said, I tried reading books about it. They weren't the right books. This book here didn't come out till 2018. There were other things that were going on in 2019 I had no idea about. And if someone had told me, I would have benefited greatly by it. But the information right now is swelling. And so by the time you're in your 50s, you've got very few eggs. And then when you go through that last year, when you have your last menstruation, you can just drop off the cliff. Your brain also produces these hormones too. Your adrenal glands can produce like testosterone. But it's the ovaries primarily that are producing these things. Like, oh, your ovaries are dried up and you're shriveling and everything. Things do shrink. The labia majora, the vulva area shrinks, causing the urethra to protrude, and you've got UTIs recurring. These can kill women. They treat them with antibiotics. Well, if you use estrogen, the vagina is absolutely hungry for it. Yeah, they'll use the words atrophy. It'll cause pain. If you're married, if you're having sex, it's gonna feel like razor blades, sandpaper. It can make it difficult to walk, wear clothing, pants. That's how bad it can get. And so knowing what fixes it, and these are things nobody's gonna talk about. So women suffer in silence until someone comes up to them and says, oh, do you have this problem? Is this happening to you? Yada, yada. And they say, yeah, well, I found out, blah, blah, blah. So yeah, reading this book is the first step in my mind. God led me to this book. I looked in desperation for it at libraries. I didn't know what I was looking for. I just came home with a stack. That was the only book at the library that I could find at the time that, was of any help. Everything else was feel-good books. This one brought facts, scientific-based facts, statistics. The psychologist, Carol, helped with the statistical information and interpreting that properly. I wanted to read some of the comments. Hold on here. If men experience the same, these studies would have been vastly advanced. Oh, yeah. Oh, yeah. That comment's been made a lot by doctors online. I wonder if there are studies done on hormonal balances on women in other parts of the world and how their bodies respond to the normal aging process, and if they are better or worse off with or without HRT. Does eliminating the shame and stereotypes around aging help? Tremendously. I mean, we can go out and talk about breast cancer night and day now. We're not embarrassed by it. We're not, it's not against our religious beliefs or anything. But there's still this huge shame, especially it happens in the United States when it shouldn't be. I would imagine in Africa too. And Australia and Australia have made great progress. They're even using testosterone. The FDA in America will not regulate testosterone for women. If you're going to get that, you have to use it off label. And off label means when they take one drug and use it for a different, medical condition than the one it was produced for. So it has to be used off label in the United States, which means it's not regulated. It may not be as safe as using something that's regulated. And some doctors will prescribe it for various things. It has side effects too. But knowing the side effects and having a doctor who can work with you when you do have problems is essential. I didn't have that for a whole year, you know, to the extent that I do now. Telemedicine's great, but if you have a problem and you need to get a mammogram or a uterine ultrasound, pap smear, which always should be done every year anyway, including mammograms, they say it shouldn't, but it should. Mammogram should be done every year, according to a doctor I listened to online. Yeah. So yeah, it is
Linda,
different in different
just
countries.
to clarify, did you say that when the reproductive organs don't form estrogen or progesterone, the brain does? Is that what you said?
So the brain can, yeah, the brain. That's well, Lisa Mosconi, who wrote the Menopause Brain, has brought forth huge, you know, information about estrogen in the brain and dementia, Alzheimer's. That's the latest thing on that. But even Dr. Avram Blooming, as I read in my presentation, talked about the effect on the brain. His wife, all these doctors, Mary Claire Haver, Louise Newson, Avram Blooming, they all horribly dismissed women, older women, for years, they admit, in their practices. When those women were suffering from menopause, number one, they weren't trained, they didn't know much about it. And all three of them have since, and starting their own menopause. And for this doctor, when his wife started menopause, and when she's 2 years into it, like me, she started losing her memory in a big way. That's when he woke up. And they've all gone beyond the pale in trying to make up for all the time they spent dismissing women for these problems. And I tip my hat off to them. I wouldn't know what I'd know without them. And knowing these things is absolutely important, because a little doctor visit, the doctor's not going to be able to tell you everything. There's just so much to know through the podcasts, the YouTube videos, the books. And there's been 2 studies, like I mentioned in my presentation, it came out in 2002, that were groundbreaking. And I can post them. And there's been a couple statements recently from the Green Journal of Obstetrics and Gynecology, which basically, you know, sums it up in a nutshell, you know, a paragraph or so, what the latest beliefs are on the use of hormone therapy and, you know, treating menopause symptoms. And I can share those too. And if anybody, you know, didn't get a chance to, you know, when I was listing these other books, you know, you could just, you know, message me or whatever, and then I can send the information to you. And there are women in the movement. They contacted me, and some of them are on the older side, and they're still trying. They're still trying to find, you know, doctors. And it's a little different up in Canada and UK and elsewhere. But UK is great. You can get it free over the counter now. We're so far behind in this country. But you know, so now our latest problem is the statement in the Lancet, which Mary Claire Haver and Lauren Stryker are fighting. They're getting 200 or more signatures of notable people around the world to fight this statement by these statements by the Lancet. They're trying to turn back the clock, bring us back to the 1800s as far as our understanding about all this. And it's ongoing. It's every day. The information is exploding. If you're an older woman, perimenopause, now's the time before it happens to get your hands on the right information, because finding a doctor who's trained, qualified to take care of these things during that 10-year window of opportunity is hard. It's super hard in the United States. I went to 5, 6, 7 doctors. Finally, the last one, who also refused to have anything to do with me except telling me to get a breast exam and a colonoscopy, or mammogram. She pointed me in the right direction and told me I had to go academic. They're all afraid of getting sued. They're afraid, and the lawsuits that came out on after the WHI, they were based on the same misinterpretations and mess that came out of it. There was good things about the WHI, but then the way it was used by the New York Times and liberal media, there's finding the right sources of information is key. And this guy, we were just listening to like a little podcast from him this morning, and I'm still learning. I learned this morning that progesterone is as effective as tamoxifen in preventing breast cancer. Tamoxifen was a drug they told me I had to take because I'd had a lumpectomy, but I never had cancer. I refused because it could make my symptoms worse. I just kept looking for the doctor who would treat me, like I deserved to be treated. Now I just found out progesterone, which doesn't cause crazy symptoms that these other drugs do, can prevent breast cancer or prevent recurring. That's why they give you tamoxifen, because of that. But the side effects of it it can cause osteoporosis, because what it's doing is it's decreasing your estrogen, because they think estrogen causes breast cancer. That's just not borne out by the proper interpretation of the many observational studies and the WHI that have been done. So Jill and Joe Biden started up a task force. Now they're funding the NHI or the NIH. If you look up how much funding has been done for women's health issues at the NIH, it is paltry. There is no question in my mind that's the reason for why we are where we are with all this. So,
Linda?
Yeah.
I just wanted to point out, so if you look at all these other drugs that the pharmaceutical companies have come up with, and yet you look at estrogen and progesterone, estrogen and progesterone are naturally obviously produced by the body, and so they would obviously have the least amount of side effects, and the only thing that has to happen, I think, individually on a per person basis is as to what level and what balance you take between estrogen and progesterone, with hormone replacement therapy, right?
Well, the other thing I learned this morning, they used to tell women, don't get pregnant if you had breast cancer or you have breast cancer. Well, women got pregnant anyway. And when that happened, when you get pregnant, your estrogen levels can go up to 3,000. Those women did not get breast cancer because of that. They didn't get recurring breast cancer because of that. Like I said, our own bodies produced all of this from the time we were 5 months old. Men, you guys produce a new set of, sperm every day. We get this finite amount of eggs when we're born, and that's what we have to work with. Now they're looking into how do we extend the life of the ovary? How do we extend life so that women who are now living to 90 don't have to go through this? We might already have figured that out by now if they had properly funded the NIH. And the WHI affected the situation all over the world, UK too, but because of what's happened, the UK is taking a second look, and they're since the pandemic, especially, it seems, they're making strides like it's unbelievable. And Australia's been ahead for a long time. And the patriarchy's involved in this. Every woman in the movement who's suffering, and I've met a few, I was able to help one a lot when I first started on this journey. And I'm hoping this will, look at my battery, hoping this can help someone else, the information, maybe someone who's not in the Bible study chat, who's not being exposed to the information. I'm going to continue to post stuff because there's news. Every time I listen to one of these people, I hear something new. Here's something different. And it's not just women. Men have to know this too because you live with us. When we go through this hell, you go through it. When we lose sleep, you lose sleep. When we're suffering, you're suffering. And the problem is when both the man and the woman don't know what's going on, what's going to happen? The man's going to blame the woman. Oh, you know what? You've just become a, you know what? I'm going to divorce you. That happened to me. Perimenopause, it ain't fun. And it didn't end up going through, but it happens so much more than anybody's talking about. And the solution is so simple. But yet difficult because you can't just go to the store and get this stuff. You have to get a prescription. The doctor has to look at you. If you're older, you should get a coronary calcium scan. You should be, looked up. If your doctor knows you're perfectly healthy, got no comorbidities, Dr. Mary Claire Haver has no problem doing the tests down in Texas and evaluating women individually based on their individual circumstances. We're not statistics. We're all individuals. We all deserve a chance at alleviating the suffering. And I'll put one more thing out there that I'm hearing lately. Blood clots, the estradiol patch does not cause blood clots. The pill, I've had them all. The pill does. I lasted 2-3 weeks on this. I got COVID, had pain in my liver area, gallbladder, and I quit. Got on the gel. Gel is okay, but this is a lot more convenient, and you get more estrogen when you use a patch. And then there's progesterone, which also comes in pill form. You take it at night, and it makes you sleep like a zombie. Estrogen makes you sleep like a baby. Progesterone makes you sleep like a zombie. So from the first night I took progesterone, I slept. First morning I took estradiol, my brain woke up. And the feeling is, of course, you're going to feel it more if you've been deprived of it for a longer period of time. Anybody else have a comment or questions they would like?
I don't have a question, Linda, but this study brought so much more awareness and interest. You've always been posted in the Bible thread. I'll read sometimes, and honestly, sometimes I don't read, but now I see, the interest, the awareness is forefront, and thank you for this study.
Knowledge is key. And this is not boring. This subject is just exploding now to listen to these people. And of course, if you've suffered from it, it's going to be more interesting to you. But like I said to Aaron one day, if you have a female relative, you're going to be affected by this. Daughter, mother especially. I mean, my mother, people in my age group, we didn't even know they were going through menopause for the most part. We just thought they were going crazy. We just thought they became alcoholics. My mother dropped out for 10 years, drank, and she was gone. And I can only, from the time I'm 13 onwards, I didn't know. My sister didn't know. We just thought it was progressing mental illness. But we got no information even from our own mothers. This can start the conversations that are needed between family members. Women can now start talking about this with their kids. Explain why you don't feel good, why you're not sleeping. There's a name for it. Maybe it's not the most perfect name in the world, but it's what we got right now. Yeah, that's the important thing, is to start the conversations, look at the information, listen to women, listen to us. We're screaming this right now, because we all know somebody, a lady at church, a couple that's having marital problems. Maybe it's just the woman needs some help. And The man needs to understand what's happening. This is not just for women. This is for everybody. You tell your sons, they're going to be prepared when they get married and their wives get older, so on. If you have sisters, whoever it is. So, is there anything else? Oh, thank you, Pam. Okay.
Thank you, Linda. It's good to know about this subject. I'm not at that age yet, but yeah,
That's
it's
good.
I wasn't actually thinking about it at all.
Yeah, it's we're all gonna go through it. I mean, if you're a woman, you're gonna go through menopause.
I know.
You may
Thank
never
you.
get pregnant, you may never get married, but you're gonna go through menopause in one way, shape, or another.
Mm,
And are you gonna know what to do? Are you gonna know what books to read? What
okay.
doctors to go to?
Mm,
Go on the NAMS website. You know, you may be having symptoms, you don't know it. Because there's like 70 of them. It's when they get worse and they get bad. And, you know, if you know what to think about it ahead of time,
So basically,
you're gonna be
hormone
prepared.
replace. So
What?
basically, hormone replacement therapy is not the same as the birth control.
It
Um,
is, it's just a much lower dose.
okay.
It's not like the birth control, and the birth control, progesterone and estradiol are synthetic.
Hmm.
And you can understand this probably better than anybody anatomically. I mean, chemically, they're not the same. All these hormones, testosterone, progesterone, estrogen, are very
Yeah.
chemically similar. There's maybe one little thing different between them. Hydrogen molecule. So I don't understand anything about chemistry, but yeah, this is just 0.1 milligrams.
Okay.
It's
The
very
dose.
little.
Okay.
What it does is, you know, it's powerful. These are powerful things. And the progesterone's 100 milligrams. They're debating whether to put me on a higher dose. I got working with 2 different doctors because I've had some side effects. You know, uterine bleeding is one of the side effects that can happen, which started after I got on this. But it can go away over a few months, you know, and they have to determine, you know, what's the cause. Is it fibroids? Is it something else? Or, you know, is it going to go away? Do you just need more progesterone? So I have 2 doctors battling between those 2 options.
So basically, you're taking progesterone and estradiol, right?
Yeah, you have to take
You
progesterone
take-
if you have a uterus. Because the estrogen alone, they discovered years ago when they were just giving estrogen, causes the uterine lining to keep building up, which can cause uterine cancer. Progesterone in a normal cycle is what is going to cause it to shed. And that's your period. But without the progesterone, I have to move right now. My battery's getting low. But the progesterone is what protects you from uterine cancer if you have a uterus. If you don't have a uterus, you don't got a problem. You just get on the estrogen and you're good to go. And it's actually, they found some better, I'm going to turn the light on, some better effects from the use of just estrogen. Although progesterone has a lot of benefits too, like I pointed out, you know, it has similar effects to tamoxifen without side effects. I mean, without hot flashes. I mean, that's #1 thing that drives women crazy. Yeah, knowing ahead of time, knowing who you can talk to, where to find the right doctors. I tried finding a doctor for this on the NAMS website, North American Menopause Society. They didn't want to take care of me either because I'd had this lumpectomy thing. But then I just kept looking. Telemedicine, there's MIDI, Alloy, there's Genève. Genève is where I was told, Elder Parminder recommended Genève to me when I was at my most desperate. Got that prescription, same day, ran to the drugstore and got it, and the rest is history. So there's online, there's telemedicine, and there's the NAMS website if you can find someone where you live, because you're going to go through perimenopause where your estrogen and progesterone are going to go all over the place. And because the progesterone is going to be really super low, estrogen is going to be really high, like 200 something to extremely infinitesimally small progesterone. Your lining's going to build up, you're going to shed, you can bleed for a month, like I did. You can bleed extremely heavy and become anemic. So whenever that happens for you is going to be different from when it happens to. Ask your own mother. That'll give you probably the best clue. Your sisters, your mother.
No, I mean my mother, she had his with her it was kind of crazy because she had punctured uterus during failed abortion, and they removed all of her ovaries, and at that time, those days, they had no idea what they were doing, right? So they just removed everything and sewed her up, and she just lived her life like so I bet she went through her
Oh yeah. Look up Sinead O'Connor after she had her oophorectomy. Yeah, well, yeah, that's called medical menopause. And that absolutely demands that a woman get on something, because she's going to get heart disease and osteoporosis and everything way sooner, depending on how young she is. The younger you go through it, the worse the outcome with all that. So yeah. So it'll be hard for you to know. Maybe if you have a sister or grandmother, some relative in the family. All the women in my family went through it late. So there's a genetic component. And just, keep an eye on what your symptoms are when I was level my whole life with cycles. And then all of a sudden, a couple of years, it's just every 2 weeks, every month, every 2 months, back to every 2 weeks. It's all over the place. So when that stuff starts to happen, that's when you know it's time to have a conversation with a qualified doctor about treating the problem. And I don't know if naturopaths, I've heard they might, prescribe these things, but it wasn't my experience. I got denied. I got eyes rolled at me by younger nurses and things like that, interns. And you don't forget that when you're at your
I'm
most
sorry to
desperate.
hear that.
You don't forget it ever when you're at your most desperate. But I'm trying to prevent other people from going through that if possible. Start the conversation, and start the education.
Thank you so much for sharing this.
Yeah. Yeah. Because nobody should go through this at all.
Hi,
There's
Linda.
no excuse for any of this.
Hi.